Welcome back to Good Day. You know, the third week in September is known as Asthma Peak Week, and it's a condition that many folks here, not just children but adults as well, suffer from. So this morning we are speaking to Dr. Purvi Parikh. You are an allergist and also an immunologist with the Allergy and Asthma Network to talk about asthma and how folks can really help that condition. So thanks for joining us this morning. You're zooming in from New York City. How are you?
I'm great. Thank you for having me.
All right. You know, here on the West Coast, we've been sort of just inundated with a lot of wildfire smoke. When it comes to asthma, my question here is, can wildfire smoke sort of get your asthma really flared up? And for people who may not be diagnosed with asthma, can they get it from breathing too much wildfire smoke?
Right. That's a great question. And the answer is yes, absolutely. Not only asthma, but anyone with any type of chronic lung condition is at higher risk around wildfire smoke. So that includes COPD, lung cancer. Even if you're just getting over a cold or bronchitis, you're at much higher risk because your airways are fighting that much harder and are inflamed. And yes, if you've never had asthma before or asthma symptoms, you can develop them from prolonged exposure to wildfire smoke.
And how do you know when it becomes asthma compared to just maybe having, difficulty breathing? When do you go and see a doctor for those questions and for treatment? And what are the treatments?
Right. So, one of the most common signs of asthma that people don't even realize is coughing. Everyone thinks it's gasping for air or wheezing or shortness of breath. But if you're having persistent coughing, especially that's keeping you up at night, that's interfering with your ability to do household chores or exercise, that is a sign you may have developed asthma. And other signs are chest tightness, wheezing, shortness of breath. So any of those things, you actually should be seeing a physician because, when your breathing is affected, it can be dangerous. Even before the wildfires and pandemic, unfortunately, 10 people die of asthma in this country on a daily basis. So you should never take your breathing lightly. Absolutely
not. And when it comes to treatment, I know we see a lot of folks with different types of inhalers. Is that the most common way to treat someone with asthma, or especially, being impacted by the smoke?
Right. So inhalers are one of the most common, but even in the class of inhalers, there's so many different types. And two people with asthma might have completely different treatment regimens. So it makes it even more important that you see your doctor, because then they can determine what the best asthma inhaler is for you, or it may be a completely different treatment regimen too. There are other medications for asthma now too, depending how severe it is.
Awesome. One more question, Doc, because I know we talk about COVID-19 and they say it does impact the lungs. People with asthma, or if they develop asthma, are they more prone to catching COVID-19?
Right. Because we know the virus does attack the lungs, anybody who has any chronic lung condition is at higher risk. Luckily, from what we saw, it wasn't a much higher risk because we had expected, like what happened with some people who had obesity or heart disease. But anyone with asthma can get any virus, even the flu virus. So get your flu shot very, very easily. So you have to protect yourself even more so.
Awesome. Well, Dr. Parikh out of New York City, thank you so much for sharing that very helpful and useful information. Again, it is Asthma Peak Week, and we're just trying to bring awareness to everyone trying to breathe a little easier out there. They'll have more information if you just head over to allergyasthmanetwork.org, where you can learn more about ways to treat your condition. Thank you so much for being with us this morning. Tina, over to you.
Thank you. Thanks for having me.
Thank you. She's celebrating